How's it going, guys? We have a past level question for pregnancy, thyroid, endocrine. Step 1, Step 2. Made many questions on this stuff. Very high yield. Before we get started, please subscribe to the channel. I really appreciate it. Give it a like, really appreciate it. Find me on Instagram, mehlman_medical, mehlman_medical. Links down below. For me, Telegram, links to the Telegram group and channel down below. Don't start the clip. 23-year-old woman, 16 weeks gestation. Well, what are her thyroid parameters, okay, in terms of TSH, free T4, total T4? And is this an effect of estrogen or progesterone? So, for this question, I'm going to just come right out of the gates and tell you the answer, and then I'm going to explain the mechanism for why we have that, okay? I think that's a better way to go about this question. The correct answer here is going to be A. So in pregnancy, we are going to measure no change in TSH, no change in free T4, increased total T4, and it's an effect of estrogen, not progesterone. Now, you need to know that, for starters, increased estrogen, not progesterone, is going to cause the liver to secrete more thyroid binding globulin, TBG. Okay? That's the initial point, which they ask on the offline nbme exams. So we're only looking at the top 4 answer choices here. Now, where it can get very fucking confusing very fucking fast is we have a transient change in thyroid hormone parameters, which I'll explain, but some students will say, well, why are those arrows not going to be what we see? It's because clinically, it's choice A, as I just fucking said. This is what matters, and this is what we're actually going to measure. So the theoretical effects, the changes that occur transiently, it's not relevant for actual clinical practice. So as TBG increases in production by the liver, that's immediately going to bind free T4. Okay, so we're going to have a transient reduction in free T4. The hypothalamus anterior pituitary will interpret that transient reduction in free T4 as though there is a paucity, as though there's a deficiency of thyroid hormone. Okay, TSH will go up transiently. That will cause the thyroid gland to produce more T4, so our total T4 has increased. But because we have TBG floating around, any of that additional T4 that's produced is immediately bound up again, until we arrive at an equilibrium point where the amount of free T4 that's available is absolutely the same. As I just fucking said, can get very fucking confusing very fucking fast. So you don't need to know that whole transient mechanism. All you need to know for USMLE, if you get one of these questions, 2 points. Number 1, it's an estrogen effect, not a progesterone effect. The second point, you're going to choose no change TSH, no change free T4, increased total T4, okay? If free T4 is out of the normal range, up or down, in any patient, pregnant, not pregnant, the patient will classically have clinical symptoms of hypo or hyperthyroidism. So the overwhelming majority of women, greater than 99% in pregnancy, although we get changes in thyroid hormone, the free T4 is the same. That's why women will not have any symptomatology of thyroid derangement in pregnancy. You know the deal. I'm the team. Make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.